We do not routinely do all three heads. I think there's some specific clinical scenarios where it's useful. Things like an axillary neuropathy, particularly traumatic. We had a lady come in a week or two ago for a repeat study where she had noticed she was able to bring the arm up but not out yet. So, and she was not previously able to do that. And then we demonstrated very early reinnervation of the anterior head, no reinnervation, and mainly because it's the largest, it's easiest to get to, easiest to isolate. All you got to do, and Beck, you'll be able to see it, or push your elbow out into my hand real hard. You can see the point that it comes down to where it inserts into the humerus. You can feel the whole thing. So I just go a couple of fingers up into the bulk of that muscle. Now, people are really atrophic or extremely thin. It can be a very thin muscle, and then you just wind up going through it. So you want to start out really superficial at an oblique kind of angle here. So I usually come up, again, along the fiber orientation, pinch, and there we go. It's pretty superficial. Relax there as much as you can. And sometimes it's very hard. The shoulders where people tend to hold their tension and all this and their anticipation. So it's just if you tell people specifically to relax the shoulder, you'll get most muscles relaxed, especially when you're doing things like the infraspinatus. That's a part of that group that just gets tense. Have them just roll the shoulder forward a little bit and relax the shoulder anteriorly. A lot of times that'll take care of that. And then the deltoid's also one of those muscles where we allow, lift your elbow just a little bit, an increased percentage of polyphasia. 25% or so of the units can be polyphasic, so that's normal. Units can also be a little bit smaller, I think. That's a good unit right there. I like this program. It does a good job of isolating the tallest peak. So even when there's more than one unit in the picture, if you can get that tallest peak in focus, you're fine. It actually does a pretty good job. And then come back out. Reinsert a different angle, very slowly. You all right? You good? Yeah, so there's a few good units in there. Still relax just a touch.